I think big things are it's becoming increasingly common in patients in the community who haven't spent time in hospitals. A long time ago, I used to only see it in elderly people who'd spent tons of time in the hospital, gotten tons of antibiotics. Now we're seeing it in young people, people who haven't been in the hospital, women who may just have delivered a baby and gotten one dose of antibiotics around a C-section or something. So the rate of C. diff is increasing. We're also seeing C. diff that's sometimes more resistant to treatment or cure. We're seeing more recurrent cases where people get C. diff over and over and over again, despite being adequately treated and recovering. As soon as they stop the treatment, a week or two later, they're coming in with a relapse again. So we're seeing more and more of that as well. One of the big things is use of antibiotics. Another is, we know that one of the biggest risk factors for C. diff is antibiotic use. Antibiotics disrupt the normal, good, beneficial bacteria flora that prevent C. diff. And so people use antibiotics a lot, kind of as a population. We've made efforts to decrease use of antibiotics and increase, antibiotic stewardship and doing the right thing, but we still see that there's a lot of antibiotics given. Another big reason is probably the aging population. More a risk for C. diff is age over 65. Your risk for hospital-acquired C. diff increases by 2% for every year you are over age 18. So the older you are, the higher your chance of getting a hospital-acquired C. diff infection. And we're seeing many more people over 65, so we're going to be seeing much, much more C. diff. For symptomatic C. difficile infection, you're seeing diarrhea, primarily diarrhea. It's often described by the patients as explosive. They become incontinent with it. Sometimes it's watery, profuse diarrhea. Some patients have abdominal pain with it, or they'll have more sort of a mucoid-looking diarrhea. Some will have bloody diarrhea. Some can get very, very sick and end up with fevers, significant abdominal pain. Actually, it can, in a percentage of people, land them in intensive care units where they're really in sepsis from it. And thankfully, that's a small fraction of the people who get C. diff, but the rates of death in that group are very high. Something like Prilosec, one of those kind of antacid or acid suppressing medications. There's evidence that use of those medicines can increase people's risk of developing C. diff. So if people are on those medications and they don't have a real good reason to be on those medications, I'll usually have them stop them. Obviously, if they're on it for some important reason, they can't stop them. The other kind of thing to think about that might modulate your risk of C. diff would be use of probiotics or beneficial bacteria that would kind of go in and potentially help prevent C. diff. I think there's fairly good data in the form of a recently published systematic review meta-analysis that shows that you may be able to prevent C. diff infection from occurring initially if you give a probiotic at the same time as you're giving an antibiotic and kind of for a week or two afterwards. And you can almost pick any probiotic out there, but they showed that you can reduce the risk pretty significantly. You have to treat about 29 patients with a probiotic to prevent one C. diff infection, but that it may be worth it, maybe targeting higher risk populations with that prophylaxis.